We are back at the shed at the Illinois State Fairgrounds, visiting with Dr. Benjamin W. Stevens from the Springfield Clinic Orthopedics. And forget about everything else. It's already been a big day for the Stevens family at the fair. Tell us about it.
Well, we couldn't wait to get here, and they waited for me to get off work. We raced over here, went straight to the produce building to see if our pumpkin won first prize. And it did. Number one at the State Fair, the biggest pumpkin.
How big was that pumpkin, Doc?
I think the weight was 166 pounds. And I think it was off a little bit. It's probably 200 pounds, really.
And is this something new for, and your sons did this, right? This is their project?
Yeah, so we all helped out kind of, together, but they put in the most work. They watered it twice a day with every fertilizer known to man, and we put all the pesticides, and people don't like that. But yes, we had to use pesticides and turn the pumpkin and tilled, and they did it all.
With this goal in mind, right?
Exactly. We harvested this one before it was even ripe, completely ripe. It would have been a lot heavier.
Will you take it back with you and carve it, or do they keep it here?
They make us take it back. My back is so sore, I don't want it back. They make us take it back, but it won't probably last for carving, so it'll just go into the compost pile. And
so is this kind of like the steer, 177 this year? Are they shooting for 200? I mean, are they all fired up now to keep doing this every year?
Exactly. They couldn't. They looked at all the other produce and said, "Dad, there's no reason we can't win all of these." So the sky's the limit.
Your specialty is foot and ankle.
You got it.
Okay. What causes foot and ankle pain?
Well, we get a lot of people coming in from the State Fair. They'll show up next week and the next month, and it's the prolonged time on their feet, and not everybody has perfect feet. So you wear the wrong shoes, or you walk a little bit too much distance, and all of a sudden your feet start to hurt. And some of these things, like heel pain, for instance, plantar fasciitis, the quote-unquote heel spurs, they can last 9 to 12 months. People are dying, and it was, if they look back on when they did it, they were at the State Fair. They wore the wrong shoes, and they walked for a little bit too much distance.
What makes for the wrong shoes?
You can look around and see these flat little flip-flops that have no arch support, and they're sliding off the foot, and you're going, oh, my God, well, I'll be seeing them in a few weeks. Yeah, it's just, if it doesn't look like a well-supported shoe, then it probably isn't.
What are some of the signs and the symptoms that would make you want to go see a doctor, besides it hurts?
Well, everybody tries a little home remedy. They say, oh, my foot hurts, and they're limping around, and they try, some anti-inflammatories or some ice, and they're trying to do little things, and they give it 2 or 3 weeks and just won't go away. That's when you go, enough's enough. Get in here before it gets, the 2 or 3 month mark is too long. It's just going to go on and on and on. Get in there earlier when you say, listen, I've tried my little home remedies. Get me something else.
Do you recommend a certain kind of shoe? Do you guys say, okay, if you're going to go to the fair, wear this?
Yeah, no, I tell varieties. It was probably about 6 or 7 years ago. I thought an old lady was going to hit me in the head with her purse, because I mentioned a certain variety of shoe, and she went out and spent her hard-earned dollar on that shoe, and guess what? They didn't work for her. And I was dodging purses there for a while. So I just tell people, listen, you get a brand-name pair of shoe that's of reasonable quality and reasonable cost, and they're probably going to do you fine. But some people hate tennis shoes, and some people love different sandals, and it's kind of a feel thing.
Orthopedics, inserts to shoes. Do you recommend them? Do you need to have them specially made? Are the ones that you can buy in a drugstore good enough?
Yeah, and that's a question we get 15 times a day. The orthotics that you put in there, some people, their feet are so bad, you've got to get a custom-made one. There's just no way around it. There's no over-the-counter orthotics that's going to make a difference for them. But for people who have pretty normal feet and they just ache, go to like a sporting goods store. Don't get the Dr. Scholl's. I don't like those. They're too gimmicky, Okay. You go to the running center here in town. Great place. Go to Shields. Fantastic place. And you can get any variety of these orthotics for different activities that you're doing. Excellent choices. $30, $40. They'll last you a year.
They'll last you a year. That's my next question. I have custom-made orthotics that I have in my shoes right now. Are they good for the rest of my life, or do I need to get those changed every once in a while?
I would get them changed every, depending on the person. Like, Not everybody weighs exactly the same amount, as we know.
Why are you looking at me when you say that?
Listen, I mean, we love the fair food. That's all right. But, our heavier people are going to go through their orthotics a lot faster than our people who weigh 120 pounds. So generally at the year mark, reevaluate. If you can get another year out of them, great. But 3-4 years in, you're asking too much. Your foot has probably changed by that time frame. So get it. Don't let them last that long.
Okay, we have sort of gotten away in I don't want to put words in your mouth. In your industry, you guys aren't big on surgery. When does a person need surgery on a problem with a foot, and when can just doing things the right way make it better?
Yeah, it's always a hard call in the long run, because almost all of we see orthopedic surgery, we see every knee and hip and foot and ankle, and I specialize in the foot and ankle, but everybody comes in and they want the fix now. And you say, well, here's no surgery for you, and it's a lot of times just not fast enough for some people, and they really want it. And I'm telling you, some people, it's everything you can do to back them off from surgery. Mm-hmm. But when you go down the route, most of the time the non-surgical method will work. It requires the person to stay diligent with it, whether it's the physical therapy or the right orthotics or some anti-inflammatories or some stretching. I mean, you can make it work. When you've exhausted those options and listen, I've tried everything you said, Doc, and I can't make this work. It's been 9 months. It's been a year. It's been 2 years. Time for surgery. And there's always a surgical backup for these things.
What's a bunion exactly?
So when you're walking around today and you're looking at all these people in their flip-flops and sandals, it's the ball of the big toe. You look down at the ball of the big toe, and on the inside of that ball, when it sticks out like a golf ball, that's a bunion.
And exactly what is it? A bone spur, basically?
It is basically a bone. It's not a spur. It's when a bone drifts over. Okay. So it's actually kind of a complex issue. The old method, people used to say, I want to get my bunions shaved off. No, there's no shaving of bunions anymore. That's 40, 50 years ago. I mean, if you want this to feel better, you try the non-surgical method for as long as possible. Most of the people try it their whole lives. They've had bunions, and they finally give in and say, listen, I can't wear any shoes. It hurts too bad. And that's where the bone that's out of position, you move that bone back over.
Do you deal much with the ankle sprain? What's the difference between a regular ankle sprain and a high ankle sprain?
So the regular ankle sprain is the common ankle where it hurts like right around the ankle joint. It's the one where you're walking down the sidewalk, you step off the edge of the sidewalk, you do a little twist, and holy cow, it swells, it rolls. You might feel a pop. That's your average one. The higher one is the stronger, stouter ligaments up the ankle. It's usually a sports injury or a higher impact injury. They call it our soccer players or basketball players. Those are the ones that take even longer to get over because the ligaments are so stout that when you stretch or tear those, it takes a long time to recuperate from those.
Back in my day, many years ago, you had your ankles taped. Do people still get their ankles taped? Is that still a good thing to do if you're in athletics?
Absolutely. These people who are nursing ankle sprains and they want to keep playing, and they can, but they're at risk for that one more sprain that's going to put them out for the season. We've got great athletic trainers all throughout the city and through the Springfield Clinic that they'll tape all of our athletes up who are at risk. And absolutely, for the games and practices, lots of taping still being done.
Tell us a little bit more about yourself. You're a Springfield guy.
Yeah, grew up here, born and raised. Trained at Southern Illinois University for medical school. Before that, went to Illinois College in Jacksonville. Okay. Before that, I was over at Sacred Heart Griffin. Okay. And we grew up here, once finished med school, did residency in Michigan, and then further training, another fellowship training, one more year of my life in Seattle, Washington.
You guys never want to quit going to school.
Oh, yeah.
You guys just love going to school.
Just loved it so much.
Why the foot and ankle? Why did you decide that was what you wanted to specialize in?
Well, we do 5 years in orthopedic surgery, and you get to go through all the specialties, spine and joint replacements and hand. And I went through all those, and I said, these are all too easy for me. I said, I don't want to do those. I better do something that's challenging, so I did the foot and ankle.
Okay.
You get to replace things. You get all the complex trauma. You get the reconstruction. People with polio and horrible foot deformities with clubfoot and things like that. We do all of it. So it's a fantastic field.
And the lady that you recommended the shoes that almost beat you with the shoes, you get those too.
That's right. You get all walks of life. That's right.
Dr. Stevens, thank you very much for visiting with us today. Best of luck to you guys. And you got football season starting, so I'm sure you'll see some kids with some bad ankles.
Absolutely. We sure will. Thanks for your time.
I hope you don't see very many, but we'll hope you see some.
Yeah.
Dr. Stevens, thanks for visiting with us. Ben Stevens from the Springfield Clinic Orthopedics. Going to take a break and come back for more on Sports Radio 1450, 92.3 FM.